Have you ever thought about getting a facelift but decided it was just too expensive or there was too much recovery time involved?
Well, there's actually an alternative option out there, one you may have seen advertised, and you wondered maybe that's for me. News at ABC's Elisa Streeter here now with more on that. Elisa.
That's right, John and Lydia. For women of a certain age, and that age can be anywhere from late 30s to 70s, you might look in the mirror and go like this, right? Have any of you done it? The thought of a full facelift is probably out of the question for a lot of folks. But then along came the weekend facelift. There is nothing like a weekend away to come back feeling refreshed, feeling younger, or even looking younger.
I wanted people to sort of like wonder, did she have something done? Or, geez, she looks like 45.
Debbie, who is 59, joined several other women at one of Dr. Edwin Williams' weekend facelift seminars. The board-certified plastic surgeon has been practicing in the Capital Region since 1993, offering a variety of cosmetic, non-surgical, and surgical procedures. One of the most popular, the lower facelift, or weekend facelift. Debbie was on board.
When I do this and you just kind of pull that back, I'm sure you've done this once or twice in the mirror, right?
Yes, I have.
Yeah.
All I see is these lines, but I'm just, my mind does not feel that I'm 60. I'm very active, and so I just wanted to have something subtle done to go with how I feel inside.
This is Debbie's birthday present.
And it's subtle, and it will not be anything dramatic, but it'll be dramatic for me.
And so with the decision made and the before photos taken, it was just a matter of weeks before she arrived for the 1.5-hour operation. This is an outpatient procedure, done with discretion in Dr. Williams' office. No need to go to the hospital. He has 2 official operating rooms.
All right, very good.
Dr. Williams begins with a precise incision around her ear, the best place to hide a scar, and begins the lower facelift. This will not involve the nose or eyes, but rather the jawline.
Surgery done well is not seen. You shouldn't be able to tell that someone looks like they had a lift.
That is why he is not pulling tightly on the skin. There is very little tension, a far cry from what you might see on some celebrities.
Celebrities often don't know when is enough.
Yes.
They become their own worst enemies.
In fact, he thinks celebrities start out with reputable plastic surgeons, but once a doctor says enough is enough, that celebrity may go find someone who will do what they want.
Why would a guy like Michael Jackson have 30-some operations on his nose, The poor guy was sick.
Fortunately, Dr. Williams doesn't have to deal with that much in the Capital Region. Instead, he sees women like Debbie who want to look the way they feel, younger. An hour and a half later, the surgery is complete and the nurses help wake Debbie.
I'm just waking up, sweetie.
She is groggy and packed with ice and ready to go home. Here's where you tell your friends you're enjoying a cruise to the Caribbean. Okay, maybe not. Maybe you just tell them the truth, right? Debbie did, and 5 days later, she is back to have her stitches removed.
You notice the big difference down along here, don't you?
Yes.
There is a little bruising or swelling, but now check her out, just 3 weeks after that. So what does Debbie think?
I feel on the outside exactly how I feel on the inside, a lot younger.
She loves it. Now, here is the before and after shot of Debbie. A subtle difference that helped her look outside, as she said, the way she feels inside. So you may be asking, why is it called the weekend facelift? Because just a few days after surgery, you can go back to work. You just have to cover your ears with your hair, they say. And if there is bruising, then makeup could cover it. But many people, well, they choose to take a few days off, as Debbie did, and then head back to work refreshed. John and Lydia.
Fascinating.
Wow, and she's right. It's subtle, but she did look refreshed. Thank you, Lisa.
And that was Elisa in the operating room.
Oh, yeah, that's right.
I was
Elisa
waiting for Williams to go scalpel, and Elisa.
The whole thing. Doctor.
Yes.